The numbers that I'm quoting are from an American study. Um, Blacks are 100 times more likely to develop melanoma than non-Hispanic whites, but Black men are at a higher risk of dying from it. And this is looking at statistics from 2011 through 2015. The 5-year survival rate for Black melanoma patients was 66% compared to 90% for non-Hispanic white patients. Unfortunately, squamous cell carcinoma is the most common skin cancer in Blacks. And basal cell, it can look different. So we want to, and we can talk a little bit about what different skin cancers, I know that may come up a little bit later, what different skin cancers can look like. But there's research now going on out of Detroit that's looking at surveillance data to study the incidence and the survival of melanoma patients by race and ethnicity. That's showing Blacks are 3 times more likely than their white counterparts to have carcinomas that are much more, unfortunately, threatening their survival. So I don't have studies from outside of the US to compare.
And those are still staggering numbers and statistics that should give all of us enough concern, for those of you who live in America, concern about our skin protection as Black and brown people. But just because we don't know those studies or we don't have those studies globally does not mean that the concern doesn't exist. It's a matter of resources. It's a matter of access to research or access to clinical studies. So I'm still sending this to my husband. I encourage everyone watching to share this internationally, because we still need to be thinking critically about our sun protection around the world. And the lack of information or lack of studies does not mean that there isn't cause for concern. So long as you have access, we, the experts, are encouraging us all to use sunblock of at least 30 SPF and applying it every 2 hours.